Second chapter is Understanding of People in Need of Nursing Care. Section 1. Basic Understanding of Aging. Basic Understanding of Aging. There are two topics. 1. Understanding of the physical and mental changes associated with aging. 2. Symptoms frequently found in elderly people and characteristics of the diseases. In the topics of understanding of the physical and mental changes associated with aging, there are three parts. Characteristics of aging. Mental changes due to aging. Physical changes due to aging. Characteristics of aging, like individual difference exists. Elderly people are more vulnerable to diseases. The influence of lifestyle can be seen. Everybody has different ways to get older and different symptoms would appear on your body. Mental changes due to aging. Mental changes are affected by the history, time, background, and living environment of elderly people, which causes individual differences. Therefore, it is necessary to understand that each person is different when you provide nursing care. Common symptoms due to mental changes are anxiety and frustration. Anxiety and frustration are caused by the fact that they are no longer able to do what they could do before. Sense of loss and sense of hopelessness. Sense of loss and sense of hopelessness are caused by the separation by death and change in role. The mental changes makes elderly people more vulnerable to depression. Physical changes due to aging. 1. Hearing ability decreases, especially the ability to hear higher frequency sounds. 2. Respiratory function decreases, which increases the vulnerability to infectious diseases. 3. Muscle strength reduces, which increases the vulnerability to falling. 4. Bone density decreases and easy to have bone fracture. 5. Renal function decreases and the frequency of urination changes. 6. Eyesight becomes poorer and field of view narrower. 7. Ability to taste reduces. The ability to chew and swallowing is reduced. 8. Vascular walls become thicker and blood pressure goes up. 9. Increases the vulnerability to constipation. 10. Dry skin. An elderly person suffers from a number of diseases that are chronic and tend to take longer to heal with a high possibility of complications. In the topics of symptoms frequently found in elderly people and characteristics of the diseases, there are three parts. Characteristics of the diseases of elderly people. Symptoms frequently found in the elderly people. Diseases frequently found in elderly people. Characteristics of the diseases of elderly people. Each person suffered from several diseases. Individual differences are extensive with regard to symptoms, etc. Aged people are vulnerable to diseases that tend to become chronic. Symptoms are not very visible. Symptoms frequently found in the elderly. Dehydration, fever, constipation, edema, swelling, pruritus, itching, insomnia, hypertension, dehydration. Dehydration refers to a state where there is a lower than normal amount of fluid in the body. A constant amount of fluid is maintained in the body, but dehydration occurs when the balance between intake and excretion is lost, caused by diarrhea, vomiting, fever, perspiration, decrease on fluid intake, etc. Symptoms are dry lips, oral cavity and skin, decreased urinary frequency and urine volume, lower blood pressure, higher pulse rate, higher body temperature, etc. Point of caregiving. Hydrate the user, especially before and after bath or exercise. Control the room temperature. Serious dehydration may lead to death. Have the user visit a medical facility. Maintenance of the balance between fluid intake and excretion by orally taking food and drink will lead to maintenance of the healthy life. Fever. When you have a fever, your body temperature is higher than normal, caused by infectious diseases, inflammation, dehydration, etc. Symptoms are high fever, flushed face, lack of energy, lack of appetite, etc. Point of caregiving. Hydrate the user. Take the body temperature. Sometimes the symptoms of fever are not apparent in elderly people. Observe carefully to check if there are any other symptoms. Constipation. Constipation is a state in which the feces remain in the large intestine for a long time. Usually, the food intake will be excreted as feces in about 24 to 72 hours, caused by reduced functions of the intestine, loss of muscle strength, suppression of the urge to defecate, etc. Symptoms are lack of appetite, stomach ache, nausea, etc. Point of caregiving. Take dietary rich food. Do moderate exercise. Make it a habit to sit on the toilet seat after each meal. Massage the abdomen. Edema, swelling. Edema refers to a buildup of excess fluid in the body due to the reduced functions of internal organs and loss of muscle strength, caused by reduced strength of lower limb muscle, reduced functions of the heart and kidney, undernutrition in elderly people, prolonged maintenance of a sitting position, etc. Symptoms are weight gain, etc. Point of caregiving. A person with paralysis tends to have edema on the affected side. Do moderate exercise and provide leg elevation higher than heart. If the user has a disease causing the edema, have him or her receive medical treatment. Pruritus, itching. Pruritus is a state of having itchy skin, caused by dry skin due to aging, change in temperature and humidity, type of clothes, etc. Symptoms are flare, rash, frustration, etc. Point of caregiving. Moisturize the skin. Be careful not to damage the skin. Don't let the user develop insomnia. To avoid infectious disease. Insomnia. Insomnia is a state in which the person experiences lack of satisfaction, having slept well, difficulties in falling asleep, and mid-sleep awakening, which causes sleep insufficiency, caused by changes in sleep content, etc. Symptoms are frustration, fatigue, malaise, etc. Point of caregiving. Control the circadian rhythm. Exposed to sunshine when you wake up. Moderate exercise. To avoid taking a long nap during daytime hours. To adjust living environment. If the user is having difficulties in daily living, cooperate with the medical staff. Hypertension. Hypertension is when blood pressure is too high, caused by heart disease, kidney disease, change in blood vessels associated with aging, diet, exercise, and the other lifestyle factors. Symptoms are headache, palpitation, etc. Point of caregiving. To improve lifestyle habit. To avoid eating salty food. To avoid overeating. Moderate exercise. Types of treatment are diet therapy, exercise therapy, and drug therapy. Atherosclerosis caused by hypertension, and it will promote cerebral vascular disease and heart disease. Diseases frequently found in elderly people. Cerebral vascular disease, heart disease, pneumonia, aspiration pneumonia, diabetes, osteoporosis, rheumatoid arthritis, cerebral vascular disease. Cerebral vascular disease refers to disorders of the brain blood vessels. It is caused by clogged or broken blood vessels and may result in various disabilities, depending on the region of the brain affected. Symptoms are headache, dizziness, nausea, vomiting, disturbance of consciousness, respiration disorder, disturbance of perception, etc. Cerebral vascular infarction is caused by complete blockage of the artery in the brain. Cerebral hemorrhage is caused when an artery bursts in the brain. Subarachnoid hemorrhage is caused by bleeding within the subarachnoid space. Cerebral vascular disease sometimes causes dementia, which name is cerebral vascular dementia. Point of caregiving, as it is related to lifestyle. Pay attention to the amount and content of food and exercise. Heart disease. Heart disease caused by clogged blood vessels and others. Common causes are hypertension, diabetes mellitus, change in coronary artery, etc. Myocardial infarction is that blood flow decreases or stops to part of the heart, causing damage to the heart muscle. The symptom is severe chest pain. Angina is caused by reduced blood flow to the heart because of narrowed artery. The symptom is chest pain. Cardiac insufficiency occurs when the heart muscle pump function is reduced. The symptom is shortness of breath, fatigue, and swelling. Point of caregiving. It is necessary to refrain from taking salt and fluid in case of edema or gain weight. If the user is having difficulty in breathing, have the user stay in bed and assume a position that will help reduce the burden on the heart. Pneumonia. Pneumonia is an infection that causes inflammation in lungs, caused by pathogens such as germs and viruses entering the lungs. Symptoms are fever, malaise, lack of appetite, cough, and phlegm. Point of caregiving. Be creative and provide drink and meals that are easy to eat. Symptoms sometimes do not show in the case of elderly people. Aspiration pneumonia. Aspiration pneumonia is caused by bacteria mistakenly entering the trachea or bronchial tube with food and saliva. Symptoms are fever, cough, phlegm, lack of appetite, etc. Entry of saliva and food including bacteria into the trachea. Invasion of the bacteria into the lung. The lungs causes pneumonia. Point of caregiving. Check user's posture when eating. Keep sitting position for a while, at least 30 minutes after meal. Do oral care. Sometimes liquid is easy to cause aspiration. Diabetes. Diabetes mellitus is a disease of metabolic disorder, causing a high blood sugar level. In type 1 diabetes mellitus, insulin secretion is lacking. The patients are often young. In type 2 diabetes mellitus, insulin secretion is reduced. The patients are often aged. It is regarded as a lifestyle disease caused by overeating, lack of exercise, stress, etc. Symptoms are dry mouth, excessive drinking, urination, weight loss, malaise. Complications of diabetes mellitus. Typical symptoms are eye, kidney, and neuropathy. Point of caregiving. Type of treatment are diet therapy, exercise therapy, and drug therapy. Continuous hyperglycemia will make any wound slow to heal. Remember, it is important to prevent complications. Osteoporosis. Osteoporosis is a disease in which the risk of broken bone increases due to low bone mass, etc., caused by being bedridden for a long time, calcium deficiency, etc. Women become more vulnerable when the female hormone level goes down. Symptoms are having a stoop back, growing shorter, having a lower back pain, etc. The affected person is vulnerable to bone fracture when she or he falls because the bones have become fragile. Lesions of bone fracture often found in elderly are humerus, radius, spine, femoral neck, or greater trochanter. Point of caregiving. Eat calcium-rich food. Exercise and bask in the sun. Improve the living environment. Rheumatoid arthritis. Rheumatoid arthritis is autoimmune disease. It causes inflammation, swelling, and pain in and around the joint and other body organs. Unlike other joint disease, it causes pain even when you don't move joint. Okay, you are done with the first section in the chapter of Understanding of People in Need of Nursing Care, which is Basic Understanding of Aging. Congratulations! You can get one step closer to be a good caregiver. See you next lesson.